I'm going to show you 3 exercises that you can do right now to improve premature ejaculation. I'll show you the exercises and then I'll tell you why each one is important. So the first thing is deep breathing, just like this. And this is important for a few reasons. So sex is a combination of the sympathetic nervous system and the parasympathetic nervous system. Sympathetic is fight or flight, and then parasympathetic is rest and digest. So what we like to say in the pelvic floor physical therapy world is parasympathetic gets the erection up, and then sympathetic gets everything out. So when you're having sex, to avoid from going into the sympathetic range, which is like fight or flight, you want to do some deep breathing to relax the nervous system. Also, when you ejaculate, one of the things that is occurring is the pelvic floor muscles are contracting, because the pelvic floor muscles are some of the muscles that surround the penis and the testicles. When you do deep breathing, what happens is they're lengthening and they're relaxing. So whether you practice it when you're not having sex or you try to do deep breathing when you're having sex, that keeps them relaxed. So it keeps them from tightening too much, which could cause you to ejaculate a little bit quicker than normal. So very specifically, what you want to do is you want to do some deep breathing, either in standing, in seated, or while you're having sex. You want to breathe in through your nose, and then you can breathe out either through your nose or out through your mouth, just like this. That's in through your nose, out through your nose, or in through your nose and out through your mouth. You'll see while you do it, your ribs expand out, your ribs expand to the side, and you may not be able to feel it, but your pelvic floor also expands down while you do it. So again, maybe about 30 times a day is probably pretty good. Second, you want to try and do reverse Kegels. So a classic Kegel is you're contracting the pelvic floor muscles. It's a squeeze. It's sort of what you do if you try to stop your urine when you go to the bathroom. But if you do classic Kegels, sometimes that can tighten the muscles too much. I don't think that works to help with premature ejaculation. You want to do the opposite. You want to do reverse Kegels, which is a bearing down or lengthening motion. It's sort of like if you're going to the bathroom and you want to push out a bowel movement, that's what you're doing, is you're relaxing, not relaxing, but lengthening the Kegels, and it's the opposite of a contraction, which is what happens during ejaculation anyway. So what you want to do in the standing or the seated position, you want to do a reverse Kegel. So you want to bear down. Again, it's like if you're trying to have a bowel movement and you want to push a little bit of it out, you don't want to strain too much because that's going to be too much on the muscles. It needs to be very slight. So you push down and hold for maybe 2 or 3 seconds. Again, very slight. Push down, hold for 2 or 3 seconds, and maybe do that, we'll say 30 times a day. And then when you do that, it'll give you more control over the muscle when you're having sex, just so before you have an ejaculation, those muscles don't tighten up too much. Third, you want to improve the strength of all the other muscles that you might be using when you're having sex. It could be your arms, your abs, your glutes. So if those muscles are strong and you have control over those muscles, you're not going to put too much pressure on the pelvic floor when you're having sex. So I'll show you 2 that are really good. So the first one are push-ups. Okay. So it works your arms and it also works your abs. Do a lot of push-ups. The second one are glute bridges. So there's a lot of varieties of glute bridges. So one, you can do with no weight. You can do single leg glute bridges. And then of course, you can add weight. Those are 3 things you can do immediately to improve premature ejaculation. I would give it a shot. I think you'll see changes immediately after doing them.